Hello, my name is Rachel Berry, and I would like to talk to you about anxiety disorders. Anxiety refers to an unpleasant feeling of fear and apprehension. Anxiety disorders reflect the clear presence of symptoms of anxiety, and anxiety is not specific to just anxiety disorders. But the thing that distinguishes anxiety disorders is the stress, fear, and obsessive and high amounts of anxiety that they feel. So there are some normal amounts of anxiety that people will experience, but it becomes abnormal when it interferes with the social and occupational functions of life. So I would like to talk to you about a few different types of anxiety disorders. The first is generalized anxiety disorder. Then I'll talk about panic disorder, phobias, obsessive compulsive disorder, and post-traumatic stress disorder. So first I'd like to talk about generalized anxiety disorder. Generalized anxiety disorder involves persistent anxiety and uncontrollable worry. So you see this guy at the bottom of the page? He's just laying in bed trying to go to sleep, but he's super worried about the ceiling falling down on him. And it's just a persistent anxiety. He can't get to bed, and he doesn't really know why he has this worry, but he knows that it's uncontrollable. There is about 5% of the population that will experience GAD over a lifetime, and women are twice as likely to develop GAD than men. So here's the facts and statistics about it. It occurs in about 4% of the U.S. population. There's an early gradual onset of it. It runs a chronic course, and very few people who have generalized anxiety disorder will end up seeking treatment for it. There are a few different ways that a person suffering from GAD can try and overcome it. The first would be psychoanalytic therapy, which involves revealing the sources of conflict that cause the person to have anxiety. Behavioral therapy involves a combination of relaxation training and cognitive intervention. And then the biological therapy involves the administration of anxiolytic drugs that will reduce the anxiety. Panic disorder is a little bit different from generalized anxiety disorder. These people feel a lot more physical pains from their anxiety. They have minute-long episodes of intense dread, which include feelings of terror. They can get chest pains, they can have problems breathing, and it can almost feel as if they're having heart attacks. Anxiety causes people with panic disorder to avoid situations that cause it to flare up. And panic disorder occurs in about 2% of men and 5% of women. There are two different ways that a person can seek treatment for panic disorder. The first is biological treatments, which include antidepressants and anxiety drugs, which reduce their stress and anxiety that they feel. And then there's psychological treatments that emphasize exposure to the situations that cause them to feel the panic. So it just kind of throws them into the situation, and they want to teach them not to fear it anymore, to such a great level at least. Next, I'd like to talk about phobias. Phobias are marked by a persistent and irrational fear of an object or situation that disrupts normal behavior. The two phobic disorders that I'd like to talk about are specific phobias and social phobia. Specific phobias are unwarranted fears caused by the presence of a specific object or situation. So blood, cuts, or shots, being in a plane or an elevator or a car, and then maybe you're just scared of water or things that are too high, which are more in nature. Social phobia involves a persistent fear involved with the presence of other people. Here is a list of some of the more popular phobias that are in the United States. So, acrophobia is the fear of heights. Agoraphobia is the fear of pain. Astrophobia is the fear of thunderstorms. Claustrophobia is the fear of enclosed spaces. Hydrophobia is the fear of water. Monophobia is the fear of being alone. Mysophobia is the fear of germs. Pathophobia is the fear of disease. And pyrophobia is the fear of fire. Social phobia is mostly characterized by the fear of being in social situations in which someone could be embarrassed or humiliated. So they mostly avoid doing any sort of public speaking and are kind of more of the people that hang out in the back of the classroom and stay quiet until they have to talk. There are some similar ways of treating panic disorder and generalized anxiety disorder as phobias. So the psychoanalytic therapy attempts to uncover the repressed conflicts using free association. Behavioral approaches try and expose the client to situations to help reduce the responses to those phobias. And the cognitive approach focuses on altering irrational beliefs about what they fear. Next, I'd like to talk about obsessive-compulsive disorder. It is characterized by unreasonable thoughts, fears, and obsessions that lead you to do repetitive behaviors. And it is often centered around certain themes. So if you're scared of germs, you have an obsession with germs, so then you wash your hands, and then you doubt your hands are clean, so then you get anxiety about it, and then you have that obsession again, and it just kind of goes in a circle and a circle and a circle. Obsessions are defined as repetitive, unwanted ideas that a person recognizes are irrational, while compulsions are repetitive, often ritualized behavior that serves as a way to diminish the anxiety caused by the obsession. This is a scan of a brain of a normal person without OCD and then a person with obsessive compulsive disorder. As you see in the scan of the obsessive compulsive disorder patient, they have a ton of metabolic activity in their frontal lobes, which is involved with directing attention to certain things. So, as you can see, they're probably thinking about washing their hands or something right here. And then psychoanalytic procedures are not effective with OCD patients, so they morely focus on biological treatment that involve drugs that increase brain serotonin activity, and then an exposure and response prevention, which is putting them in situations that ignite the compulsion, and then restraining the client from performing that certain compulsion. Next, I'd like to talk about post-traumatic stress disorder. This occurs when a person has 4 or more weeks of the following symptoms. So, haunting memories, social withdrawal, jumpy anxiety, nightmares, and sleep problems. Here's some facts and statistics about it. It occurs in about 7.8% of the population. Trauma is necessary but not sufficient. The severity of the response is very important. It runs a chronic course, and the most common reason people get post-traumatic stress disorder is due to traumas that are associated with combat and assault. There are 2 different ways that a person can get treated for post-traumatic stress disorder. There's the eye movement destabilization and reprocessing, and thought field therapy. A lot of people that go to war in Iraq and stuff come back and they have problems, normalizing back to normal life here in America. So they'll go to therapy groups and talk about their experiences with other people who have experienced the same thing, and it has shown to really help them come back to society and kind of start over, which is great, I think, because they did us a service to our country and they deserve that sort of treatment. But For more information, these are the sources I use, so if you're interested in learning anything else, these are some great sources. They had a lot more stuff that I wanted to include, but since we had a time restraint, I couldn't include all of it. But if you guys want to check it out, these are some great sites that I went to, and then these articles are also really great. Thanks, guys, and I hope you have a great rest of your semester.